Good morning, guys. What do you do in an emergency? Do you panic? No. Well, you shouldn't panic, okay? Because in an emergency, it's a very stressful situation. Everybody is panicking. But if you're a thinking man, you don't. You take a deep breath and think, right, what's important? In a cardiac arrest, ABC, airway, breathing, circulation. It's always the same. You don't start circulation. Well, you actually that's changed a little bit actually, because it is hemorrhage control, is now with A. But what you should apply is a simple, logical and methodical approach to a situation. That should be true in everything. So it doesn't matter if it's a stressful situation, you should apply a logical, methodical approach. We have a tendency to overcomplicate things, to over-intellectualize. Did I say that right? Intellectualize. And it's really important to be able to contextualize all of the information in order to actually affect a positive outcome. So when it comes to testosterone replacement therapy, you can have a primary problem, so a problem with the testicles, a secondary problem with the brain. You can have a mixed problem, so a problem with both. Now, testosterone deficiency syndrome also includes a cohort of patients who have no real definitive cause. Now, if you adopt this logical, methodical approach, you go, well, you do not have a defined primary problem, you do not have a defined secondary problem, and you do not have a defined mixed problem. So you cannot have low testosterone. Well, there's an absurdity to that. So you do have to actually think a little bit outside the box. Science is ever evolving. Medicine is a practice. So we are constantly looking at ways to improve. The research is constantly evolving and changing. But you should always apply a logical and methodical approach to whatever you do. And we over intellectualize stuff, and it really is about keeping it simple and keeping it safe. So when it comes to TRT, it literally is replace the testosterone and replace the LH with HCG. So we are mitigating the side effect of pituitary suppression with HCG that mimics luteinizing hormone. That should be it. So what you should do is you should optimize those levels and not address multiple variables. All hormones are dependent, not independent. Whether they have a direct or indirect association, it amounts to the same thing. So if you affect one hormone, it has a knock-on effect on another hormone. So we see that with the thyroid. So a low thyroid causes a secondary picture. So you should always assess the thyroid before commencing TRT, and that is a far simpler issue to deal with. So always look to find a reversible cause. Hyperthyroidism, conversely, causes an elevation in SHBG, and that can obviously reduce your free testosterone. So adopting a logical and methodical approach is 100% necessary, and we need to be able to have an open and sensible discussion about the solution to these issues, because unfortunately there are a lot of big fish in little ponds, and they are fighting to protect their opinions and not using common sense and changing with the times, which is rather disturbing, because these guys are highly qualified and they have over intellectualized the whole thing, although they can't do really if they don't believe HCG is important, and they cannot contextualize the big picture. So unfortunately, like a specialist will do one thing very well, but you also have to be a generalist as well, which is why actually a GP involved in testosterone replacement therapy is actually a really good avenue to take, because GPs do appreciate the holistic approach that's necessary to attain health. Well, I hope they do. So it is much more than addressing a single condition and one element of a million elements that can be affected. So having GPs in helping manage testosterone deficiency syndrome is actually really important, because we bring something very different to the table. We have the ability to contextualize all of the information and hopefully apply it. Hold on. 2 minutes. I'm doing a video. So where was I? I will put a link to how to diagnose low testosterone, which will go over all of the pathologies, the risk factors that need to be taken into consideration include obviously anabolic steroids, alcohol, recreational drugs, antidepressants, opiates, head injury. There is an alarming cohort of patients who actually don't appear to have any risk factors, but they have low testosterone. And perhaps there is a genetic element to this. So one guy recently had genetic testing, and it's going to take 18 months for the results to come back. Sorry, Shan's standing in the sunshine getting some rays before coming into clinic. So, well, I've lost my train of thought again. Yeah, so it's important to be able to actually identify a cause, but it's also important to appreciate that actually, what are you going to do with that information? So this guy, poor guy, was expected to wait 18 months for his results. So if he did have a genetic abnormality, what are they going to say? Yes, yes, Mr. X, you do have a genetic abnormality. So, yeah, you need TRT. Well, surely he should have been on TRT 18 months ago, because if he struggled for 5-6 years and he's done all the right things, looked at his lifestyle, nutrition and exercise, and there are no obvious major parameters that could be addressed to improve his levels, is it ethical to let this poor guy suffer for 18 months? And I believe the answer to that is no. But you must show due diligence. You must establish a diagnosis and do a thorough blood workup. You must have a face-to-face consultation with the clinician to see if he can identify anything that's potentially reversible and that would prevent you from needing TRT, because it is a major commitment, and I think people need to appreciate that. And it's something that gets slightly overlooked in advertising by certain people. It isn't always plain sailing. So it is super important to actually contextualize and look at the patient as a whole and act in their best interests. And I think there's a reservation by the NHS in doing this, because if you do not fit into a certain pigeonhole, it's the computer says no. So it's Little Britain, and I think one of the things that we should adhere to, uphold, is do no harm. Okay, and if somebody is struggling with mental health problems and physical problems, and you've identified low testosterone and you've excluded a reversible cause, then it's ethical to have a frank, open discussion about the risks and benefits of TRT and decide what's best with that patient that's sat in front of you. You need to be confident, they need to be confident that you are acting in their best interests. As I've said before, you are not shopping for TRT. This is a medical condition that needs addressing by a qualified clinician that will act in your best interests. Have a nice day, guys.